Most people track body weight, body fat, or cholesterol, but very few track VO2 max, even though it is one of the strongest predictors of long-term health. VO2 max is the maximum amount of oxygen your body can use during intense exercise. It reflects how well your heart pumps blood, how efficiently your lungs bring in oxygen, and how effectively your muscles use that oxygen to produce energy. Because it reflects how well your heart, lungs, and muscles work together, it provides a clear picture of how your body performs under physical stress. Large scale research, including studies published in the Journal of the American Medical Association, shows that individuals with low cardiorespiratory fitness have about a 2 to 5 times higher risk of early death compared to those with higher fitness levels. These are typically people who fatigue quickly during moderate activity or rank in the lowest performance categories for their age. Individuals with higher VO2 max values consistently show the lowest risk. These are people who can sustain higher levels of effort for longer periods. VO2 max is measured in milliliters of oxygen per kilogram of body weight per minute. This reflects how much oxygen your body can use relative to your size. Even small increases in VO2 max are associated with meaningful reductions in both cardiovascular disease risk and overall mortality. VO2 max is most accurately measured in a laboratory using a graded exercise test. This is typically done on a treadmill or stationary bike while wearing a mask that measures oxygen intake and carbon dioxide output. The intensity increases every few minutes until you reach exhaustion. At a certain point, your oxygen consumption stops increasing, even though the workload continues to rise. That plateau represents your VO2 max. While laboratory testing provides the most accurate measurement, it is not practical or necessary for most people. In practice, VO2 max can be estimated using structured field tests, such as a 12-minute run or step test. These use performance outcomes to approximate aerobic capacity. Many of these tests can be performed with a smartwatch or heart rate monitor, which also provide their own VO2 max estimates by analyzing heart rate and activity data over time. While these methods are less precise than laboratory testing, they are useful and practical for tracking changes in fitness. Improvements in VO2 max are driven by training that places sufficient demand on the cardiovascular system. Moderate intensity training at around 60 to 75% of your maximum heart rate builds aerobic efficiency and provides a foundation for sustained performance. Higher intensity efforts, typically in the range of 80 to 90% of maximum heart rate, provide a stronger stimulus for increasing maximal oxygen delivery and utilization. This is often achieved through interval-based training, where periods of high effort are alternated with recovery. For that reason, training your cardiovascular system at the appropriate intensity is not just a performance strategy, it is a key component of long term health.